Welcome, everyone. Good morning from Socrata's headquarters in Seattle, Washington. My name is Bryant Lau, Marketing Manager here at Socrata. Before we get started, I want to remind you that we will be available to respond to your questions and comments during the webinar in a number of ways. You can tweet to #OpenData or @Socrata. You can also ask a question directly via the comment box below at the bottom of your screen. Replay the webinar anytime on Socrata's YouTube channel, youtube.com/Socrata videos. Thanks again for joining. We're all looking forward to learning from our panelists' experiences in open data. So here to introduce the panel is your host, former Presidential Innovation Fellow, Ian Kalin. Ian, take it away.
Thanks much, Brian. Hello, everybody. My name is Ian Kalin. I am the Director of Open Data for Socrata. And this webinar is to talk about getting citizens engaged with your data. And so to guide us through this conversation, to share some extraordinary stories about how this actually works, we have Tania Allard. Tania is the Director of Intergovernmental Affairs and Special Projects at the New York State Department of Health, DOH. Currently, she is the Director spearheading the Maximizing Essential Tools for Research, Innovation, and Excellence Project, or METRICS, which is just a great name. The METRICS project is a multi-year open government initiative to increase transparency and facilitate the strategic release of data assets to support innovation in public health service delivery. Before Tania's current role as the Director of Intergovernmental Affairs and Special Projects, she's worked in public affairs, the New York State Executive Chamber, the New York State Assembly, and the New York State Office of the Attorney General. Recently, she helped launch health.data.ny.gov, so the New York State's health open data platform, and was awarded the first annual Health Data Liberator Award for Health Data in New York at the National Health Data Palooza Conference in Washington, D.C. So we're all very, very excited, of course, Tania, to hear your stories. And as a first opening question, well, of course, we'll have a chance to engage with all the wonderful people. I do believe that's a fire alarm in the background with Tania. So that's the same fire alarm that came up 30 seconds before we kicked off the webinar. I'm going to assume that it's also a drill, and we're just going to keep on charging. And I'll let Tania say. Okay, first question: are you safe?
I think I am at the moment.
Okay, let's keep going then, and we'll see how this goes if you need to run away. But as long as you're still safe, I will ask the actual open data related question. Why is New York State publishing health data? And Tania, as you answer, I'll let you know if we can't hear you with the background alarm.
Okay.
So why is New York State publishing health data?
Well, first, thank you so much for inviting me. I'm thrilled to be here, and I'm thrilled to be able to share the story that we have here at the New York State Department of Health. We have a variety of reasons for wanting to put more health data out and make it available to New Yorkers. The first being just to provide valuable information to New Yorkers will help New Yorkers make more informed public health decisions, and that's primarily our main goal here at the Department of Health, to do that. A lot of data that we have wasn't necessarily accessible before, and so this is a new way to make that available. We also want to support research and students here in New York State and allow them to be able to analyze the data, and also be able to analyze it in a way to drive new creative thinking around public health policy. We also want to spur innovation using the data, which is definitely a new thing that's taking place across the country. And then lastly, we'd like to support DOH employees as well. More data that we have that we can make available publicly means less work for them to have to get it, and then they can use it for their own grant writing purposes, or to help improve the quality of their work.
Excellent, excellent. So there's definitely different customer groups, if you would, that seem like that are engaging with this data. I want to come back to that, but first maybe I can ask the simple question of what data are you publishing? Maybe we can start there and then drill into the different community groups.
Sure, we have a variety of data, everything from popular New York State baby names to food service establishment inspection data. We also have inpatient hospital discharge data, hospital-acquired infection data, and so it's very broad. We have managed care, some Medicaid enrollment information. All of the information that we provide, we feel is valuable to the public, and we feel that by having more input from the community and from the public, we will continue to put more valuable data up.
Interesting. So this webinar is about getting citizens engaged with your data. And so maybe that's the way that we can kind of combine a bit of the data sets with this particular topic. How did you choose which data sets to publish? I mean, it sounds like you obviously engaged with some of the folks, like you said, inside DOH, inside the government agencies. But how were you able to basically triage or prioritize which pieces of information to publish first?
Sure. So one of the things we did when we first decided to make open data or create an open data site for our health data was we did a lot of research, and we realized that what we had probably already in-house is what we should look to. It's like FOIL requests. When we took a look at what we were receiving.
And so, sorry for interrupting you, but I know sometimes we have folks from different communities. When you say FOIA, not everyone necessarily knows what that acronym stands for.
Sure. It's the Freedom of Information Law in New York State. And so any information that's not readily available, New Yorkers have the opportunity to request it from state agencies. And so the Department of Health receives over 5,000 FOIL requests in a year. Wow. And so what we did was we evaluated those requests, and what we saw was a pattern that kept coming in for same information and the same data. So we said, well, if this data is requested frequently, then it must be really valuable to New Yorkers. And so that was one way that we started the process to see, what data we should make available immediately. And so from that analysis, we were able to put out a lot of important information that normally we would not have. And we also were able to put out additional information along with that data, such as metadata, which you would not really have received if you had a FOIL request.
Interesting. And so, of course, that metadata also improves discoverability. It really is the standard that allows the interoperability of that data sets even without having to necessarily know what you're looking for, right?
Right. With every data set that we put out, we make sure to include metadata, and metadata, our definition of that is an overview document that includes background about the data. We have data dictionaries. We explain how the data is collected. We explain the frequency of updating it, any limitations with the data, and also we like to provide any additional information that would help support that data, like an annual report or links to other information that's similar, so that our users have a full range of resources available with that data. And this ensures that it's understood and that people can use it in the way that they really want to use it, and it won't be misinterpreted or misused.
Excellent. Excellent. So you mentioned the school communities earlier. Maybe that's a good way that we can dive a bit into one of the topical areas of what's included on your health data site. So I was recently on your site, and I saw that a few months ago, you and your team put out student weight information on the open data site for the first time. So how was that data received?
It's been received very well. This is important information. It's student weight information, and it is data that's collected from all middle school, elementary, and high school students from the 680 different school districts in New York State outside of New York City. Yeah. And what it measures is body mass index and student weight information. And prior to it being released on our site, I think you would have had a FOIL for it. And this information is valuable because it helps the communities understand what's going on in their community regarding to childhood obesity. And so now it's very easy to go and say, okay, we have a problem here at our elementary school, and maybe we need to reevaluate some of the activities that we offer our students, or maybe we need to have some targeted interventions to be able to help students be more healthy. So we actually were very happy with the results of making that data available because the media actually ran a lot of stories about it. And we got a lot of feedback from parents who were thrilled that this information was now available.
Excellent. And so the weight of students is a proxy also to understand the greater health of the community, the health of the student. I would imagine that an individual person's weight is private information. So I presume that all the press coverage was positive and that you didn't have folks throwing extraordinarily terrible accusations for violations of privacy. So as a way to get citizens engaged, how did you do that? How did you balance the rigorous protection of privacy with this open data value that actually drove a healthier community.
Right. So here at the Department of Health, privacy is so important, and we take it very seriously. We have a thorough review process that we implement here in the Department of Health, and it involves a multidisciplinary team throughout the department. It ranges from the program experts to our representatives from our legal department, our public affairs group, and the commissioner's office. And we ensure that we do everything possible to de-identify any type of patient identifying information, and the process adheres to HIPAA, the Privacy Act, as well as any public health regulations or restrictions. We definitely take all of those into consideration before we even consider releasing this type of data to the public.
Excellent, excellent. No, that's a fantastic. It's reassuring to hear on so many levels. I think when it comes to personally, when I've seen privacy processes put in place, there's definitely a technological component, but ultimately, it's reliant on the people that are executing it. And
Right.
the health sector is an interesting one because I think with HIPAA, with federal laws it controls on health data, there is a greater framework, a stronger framework to protect privacy. But I think people are still rather uncertain, honestly, as to how to enforce a rigorous program like that. And so I think to some extent the health community may have a stronger foundation, but it tends to be more interesting and potentially dangerous data. I'll just share a personal confession. Even though I was working in the energy space a few years ago, I think my medical record is much more interesting than my energy bill. My line graph of kilowatt hours may be very good for very different reasons, but typically a health record has just inherently more interesting stuff in it. And so I think that it also creates an extra layer of complexity, really a responsibility for government agencies to take that extra burden and make sure that that privacy is protected.
Right, and we actually we classify our data in different levels, and the data that we're working with now is considered our level 1 type of data, and then if there is any de-identifying that needs to take place, we ensure that that's done. But we also have a game plan, if you will, for how we'd like to work with researchers and others who would like to pursue more restricted data.
Okay.
And we are rolling out Health Data New York in 3 phases. We just finished phase 1 with the establishment of our site. And so as we move forward, our goal is to build in a more secure type of access point within our site to allow people to have more access to restricted data. Obviously, they would need to follow a data use agreement and enter into one like that to ensure privacy is protected. But we also envision down the road in phase 3 that we would be able to offer requests for proposals so that we can engage with the community and see what data we can make available and what they could do to help us analyze certain problems that we're seeing across the state. So that's kind of how we're going to move forward as we build our site and get more involved with the analysis of data and really driving public health policy in New York.
Excellent, excellent. So in terms of the different levels of access, it reminds me of the process that has been established for the census information. The census obviously has some degree of private information in it, but not only is there an aggregate layer that is presented to the public, but there's also an entire system where individual researchers or businesses can gain greater access, but only if they conform to very strict terms and conditions, non-disclosure agreements, and other basically legal protection and privacy controls. That's very interesting that that model is being leveraged at the state level. So going back a bit, actually, I wanted to talk a bit more about, you mentioned the story around metadata. And as we think about getting citizens engaged, I will confess, even though I obviously love this sector of open data, I will also confess that the average person doesn't necessarily get as excited as I do about it. And I think a lot of it is because of the messiness. Open data can be a bit dirty. And so metadata, you mentioned, helps the discoverability. So my question from your experience, how are you able to get people engaged if the data is not necessarily standardized? Do you need to have the data standardized before publishing? Is it the raw data alone that you released, or does New York provide any visualizations on top of that data to help the average person get engaged?
Right. Exactly. There are some people who are more inclined to just looking at the data and understanding it. And then there's others who need more of a visual presentation of the data. And so we have taken that into consideration when we were devising the way to make our data public. And
Okay.
we do offer visualizations with most of our data sets. And we do this, it's a decision that we made here at the Department of Health to do, so that we can direct the public to certain things that we feel are really valuable in the data set that maybe they might not see with just the raw data. So we have a number of charts and maps that we make available on our site. I think we have 61 charts and 19 maps that accompanies our data sets. So we work hard here to try to make it as easy as possible for people to really take in the data and see how it relates to them. There's also the filtering capability with the visualizations in the charts, so that people can, if they're only interested in, the percentage of obesity in adults for Albany County, they can filter that information in and be able to search that way with our prevention agenda indicator data. We also have maps, which is awesome, I think, to be able to see what restaurants are in your area and then be able to see any citations that have been issued for food establishments. So yeah, we definitely feel that it's beneficial, and it's an element that really has to be there for a total understanding of the data. Now, users can also create visualizations on their own. But we just kind of felt like we wanted to help them along in case they didn't want to make them on
that
their own.
first step to
Right.
kind of guide them to see what's possible. Interesting.
Right.
Well, I got to ask. So obviously we're on the internet. So hopefully the folks that are watching this webinar have the simulcast going. That there may be, even with this discussion of the visualization, going to a queue. But I mean, let's just assume that half the people online right now are checking it out. Are there any particular visualizations? So you mentioned the restaurant inspection. Do you have some other favorites do you think that people should start with to see what's possible with this data?
Oh yeah, sure. Sure. That's a very good map. I think, and again, you can tailor it to the location that you're in New York State, and it'll give you the closest restaurants, and you'll be able to find the information about citations most recent. We also have a nursing home weekly bed census map, which was actually one of the first ones that we went out with, and that allows people to search for open beds within nursing homes close to their home. And this is really important for people who are searching to place a loved one and they're not really sure, what's available and how close these institutions are. So we find that that's very valuable for people as well. And so I think it just depends on what you're looking for, but I think that you'll see our maps were designed with easy functionality so that it makes it easy for people to find what they're looking for.
Absolutely. Yeah, in the world of data visualizations, maps have an interestingly powerful effect, I think, on the average user, average person that's interacting with it. I think maps create an emotional sense. If it's a map of your own home country or hometown, it's interesting to see how people can react. And I think that it's an interesting decision that New York made, not just to open up just the raw data to people, but also provide, one step you took was to provide metadata at the point of upload to improve the discoverability, but also to provide some initial cut of visualizations to spur the imagination. That's interesting. It's very interesting that New York did that, and it sounds like it was very successful, that you didn't have to do all the work of extracting the value from the data, but just a little bit helped folks understand what was possible. So interesting then. Oh, sorry, please go ahead.
No, and we just wanted to complement the efforts of the users who wanted to also make their own, but maybe there's a few users out there that would prefer to have something in front of them that they can react to, and then they can start building their own visualizations based on what they see there.
Right. Excellent. So one of the last questions I have then, before we turn it over to our online audience to ask us questions, to ask you questions. Really, you've demonstrated what's possible. Right. So my last question is, other governments are trying to achieve the kind of success that New York has achieved. So why do you, Tania, think it is hard for governments to know which data sets are most valuable for people? Why is it so hard for governments to get citizens engaged with data?
Well, I think, and this is based on my experience here, state governments and localities, and even the federal government, they're faced with so many challenges on a daily basis. Whether it's, for us, it's state and federal mandates. We also have, we're short on resources, and people are often doing more than one job on any given day. And so it makes it hard for people to think outside the box to see and to imagine what's possible if we could do things differently. And I think that's just mainly that's the challenge. It's a cultural change within agencies to start saying what is possible, what can we do differently, and what can happen as a result of that that's positive and can impact the public in a way that we really didn't imagine before. And so we've been very fortunate here. We have a very strong support system from our federal partners at HHS. And so one of the first things we did was we also consulted with them when we were thinking about an open data site. And we said, how do we even start? And they said, well, you need to look inside. Yeah. And you need to get input from, the folks that know this data the best. But also, you need to also tap into the resources that you have. And we have over 50 local health departments throughout the state that we interact with daily. And so it's the simple questions. What data do you need?
Right.
What are you missing? What can we make available to you that would help you do your job better? And then, of course, it's the FOIA requests. What does the public want? We also try to engage with the community and the colleges and the students to see what new research is going on that maybe we can help supply some information to that, if they're looking for trends or they're looking for historical data. I mean, we've had some conversations with student groups and other academic universities, and they have been really helpful in that regard. So, I think that it's also some of the best information you're going to get is along the lines of what you're thinking too, because you're a citizen. And so, what do you think you need, or what would you like to see available to you that would help you make a public health decision about either your own personal health or a loved one? And that's kind of where you need to start. We also are fortunate to have the leadership of Governor Cuomo here in New York State, and he believes that New Yorkers should actively participate with their government. And so our site is designed for that, as well as the larger open data site, Open New York. Right. And so one of the really cool features about Open New York is that the governor also, he actually extended the offer to make locality data available on the Open New York site. So if there are local governments who feel that they want their data out, there's a way for them to do that. So we were really lucky. And I guess one of the other things I failed to mention, just to be clear for the users, is that all the data that you find on Health Data New York is also made available on Open New York, and that's at open.ny.gov. And our data is also available on the federal healthdata.gov site. And we worked with our partners to do that. So that's another way for us to get feedback is through the federal site. We also have a suggest a health topic button that we located in the very middle of our page so that it's at eye level to really get as much feedback from the public as possible about any suggestions they may have for additional data that we don't have currently. And we've actually published some data recently based on some of those suggestions, which includes registered organ donors for in New York State, which somebody requested online. And then we also made environmental data available that was requested. So we just feel that if you can tap into the variety of resources that are available to you, you may not even know the resources until you start thinking that they could be. And that was our experience here.
Yeah, on that last point, there is this kind of common conversation I think people have had that have tried to get the right data out. It's, what data do you need? What do you have?
Right.
Well, what do you need? And as you mentioned, there's other ways to engage very specific groups, understanding what you think you need as a professional and also as a citizen. You talked about the different groups to engage with. And even, I will say, that button, the suggest the data set, it's funny, when in our customer life, when we shop for something at a certain store, there's even online, there's an expectation that we can, if you're not getting the right level of customer service, that you have a button like that. But in a lot of government websites, that button doesn't exist, really. And so it's interesting. It's, in a way, we're talking about citizens getting engaged with your data. But so I think, to your point, a lot of the best ways to reach that achievement is to treat them as customers as well as citizens, and that ultimately will drive that better level of customer interaction. So we have a couple of questions coming in,
Okay.
and I think we'll try to. We have about at least 5 minutes. We didn't exactly schedule a hard stop to this webinar, but let's plan on just a few here and see what folks have from our community. So the first question: have you seen a reduction in FOIA, Freedom of Information Act, Freedom of Information Law? Have you seen a reduction in those requests since you've launched this program?
The answer to that is we have seen a reduction in the workload for program areas who have previously had to respond to FOIA requests. We really don't have a solid mechanism for being able to track actual numbers of FOIA requests coming in, but we can definitively say that program areas are reporting that previously to making certain data available on our site, they would have had to spend many, many hours responding to a FOIA request. And now, if they even get a request without a formal FOIA being requested, they just suggest that that person or that entity look at our website and can get the information from there. And so a formal FOIA request is never actually submitted, so it's hard to measure if we're getting them or not.
Non-action,
Right. So, but we have seen significant reduction in people having to respond to very, very long requests for data.
Is it fair to say then that there's cost reductions that have been achieved as a result of this program? Is that a fair statement?
Well, I think that it makes the Department of Health more efficient, for sure. I think if people do not have to spend hours, collecting data and getting the data out, and when they could be doing something else, that's definitely productive for the department.
Right. Okay, yeah, I can see that. Increased efficiency. Okay. Well, we have another question coming in. We're going to fire through these. And again, for those that are looking to ask questions, please feel free to do so through the chat feature on the Google Hangout. So the next question, what do you hope to see in the next 2 phases of the site's release?
Right. So we're moving forward. Actually, at the moment, we are planning a New York's first ever health data code-a-thon for December, and so we're working hard with that. And next year, we hope to hold an innovation challenge focused on a health topic. So on the innovation front, those are some things that we're working on. Specifically to what we're doing regarding Health Data New York, we would like to improve upon our website, and we are working to create public health dashboards, putting and linking our data together so that the public can get a better idea of the health status within communities across the state. And so that's one of the challenges that we're doing right now to make that data available, and then also engaging with our other agencies, our sister agencies in the areas of mental health, substance abuse, to really bring in some additional data that we feel will be very valuable to these health dashboards.
Excellent, excellent. Well, I think that's actually about all the time we have. Although the webinar was titled 5 Tips for Getting Citizens Engaged with Your Data, I think we covered a lot more than 5, and so I'm hesitant to try to summarize. But I will give maybe just a final pitch to the floor. Tania, anything else? Any final words that you'd like to share about the New York State experience that may be interesting? And for those that are trying to achieve New York's level of success, any final words?
I guess I would just say that we, at some points, as we were developing the site and actually doing that cultural change within the department, it was hard. It was not an easy task, and it's something that if you really believe in it, like we do, and like our commissioner, Dr. Nirav Shah, does, it's possible. It may take a little bit of time. This has been a project that we started in 2011, and we just launched our open data site this year. So it took us 2 years to get there, but we did, and the results have been fantastic. And as we keep, moving forward, we hope it's going to get better and better. And I guess it just needs to be diligent, and and it'll pay off in the long run.
Excellent. Well, thank you so much. In closing, Tania Allard is the Director of Intergovernmental Affairs and Special Projects at the New York State Department of Health. She helps run the award-winning New York State Department of Health open data platform, health.data. socrata.ny.gov. My name is Ian Kalin. I'm the Director of Open Data for Socrata, and thank you all so very much for participating in this webinar.
Thank you.